Hey, I'm Dr. Michael with Foothills Pediatric Dentistry. Today we want to talk about a common problem for newborns, and that's ankyloglossia. That's just a fancy way of saying tongue-tied. Parents usually become aware of this problem when their child is having issues breastfeeding. Specifically, they're having problems latching. This is an issue that arises from the tissue called the frenum. This tissue attaches the base of the tongue to the floor of the mouth. You can see here in this infant that the tissue attaches right at the very tip of the tongue. We can do a procedure called a frenulectomy to remove some of this tissue so that the child can then stick out their tongue a normal length and have normal mobility of the tongue. We can perform this procedure in our office using a small handheld laser. The procedure only takes about 5 minutes, doesn't cause any bleeding, and usually has very little sensitivity associated with it. If you take care of this procedure in time, not only is it going to help with breastfeeding, but it's also going to greatly decrease the chance that your child has a speech impediment in the future. Another problem that some parents notice is a large gap between the front teeth. Sometimes this gap is due to the upper frenum that is really thick and attaches down in between the teeth. We can also use our laser to remove this tissue without causing any scar tissue. The removal of that thick tissue will allow the two front teeth to come together and create a much better aesthetic appearance. If you think your child has one of these problems, please give us a call for an evaluation and we'll determine if a frenulectomy might help.